multiple health sectors around the state with a common interest in improving health and health equity. As ACHS, better align resources and activities, they support wellness in a system that delivers care for the whole
So if
person.
you can project your voice to the right here.
Okay.
And welcome, Marya. Did I get it right?
Yes, you got it right. That's perfect. Thank you so very much. So I was just asking if I needed to use the mic for the on-screen, for the online folks, and I was told that I don't have to. As long as I project, speak loud and proud, which for me is a really good thing, because if I get a hold of that microphone, I'm liable to start singing. So, given that I want to respect your time, we'll save the singing for another time. I want to thank you so very much for the invitation to be here with you this evening. It really is an honor to be here on behalf of HealthierHere, but most importantly on behalf of community. As I indicated during the introductions, I am the Director of Equity and Community Partnerships, but before I became the Director of Equity and Community Partnerships, I come from community. So I hold coming from community as the frame with which I do this work and how I walk in this world. I've had the pleasure of working with Jihan, with Hani, with Abdurrahman, with Ahmed. It's just a pleasure to see you all in this area and in this arena, and again to be invited into this space. So I'm going to share with you some information tonight to provide you with an overview of what HealthierHere is, what this accountable community of health is, and most importantly, know that it is much larger than a 20-minute conversation. So I do appreciate the opportunity to have this time on your agenda, and my hope is that it sparks additional interest in this work and in this conversation, and that this becomes part of an ongoing conversation. So I've shared with you all a copy of the slides that I'm going to reference as I talk tonight, and those of you who know me know that I don't usually speak from slides because I prefer to speak from my heart, and I'm sharing the slides with you tonight because I also recognize the power of language, and I want to make sure that you all have some of the language and some of the jargon that is going on around this whole accountable community of health work. So I'm not going to read these slides to you, but I want you to have the slides so that you can have the language, because language unlocks, right, power and access into systems. And that's part of really the heart of actually why I am at HealthierHere. So HealthierHere is a new organization. It is a nonprofit organization that really is designed to bring community together in a coalition around advancing better health outcomes for all members of our community in King County. How many of you, just by show of hands, have heard reference to accountable communities of health? Right? A lot of folks in the room raising hands, probably about 80% of the folks in the room raising hands. Now, how many of you who raise your hand understand the accountable communities of health and what it is? Raise a hand. Yeah, now we got about 2, 3, 4 hands. It's okay, it's not a test. I will not be issuing a quiz after this. I share that and I ask that question because this is really complicated stuff, and I think we make it more complicated than it needs to be. I'm an attorney, and it's complicated stuff to me. Really, what it means is that people of color, people with lower economic means, people who are new to our community are dying sooner than others who have money, who have means, who have opportunity, who have access to power. That's what this means. And so the accountable community of health is actually formed to help to begin to coalesce around health equity, right? So how can we bring one another together from multiple sectors to ensure that where a person lives, where a person comes from, what a person's education level is, what language a person speaks in their home, is not going to determine the number of years that they have on this earth. So our work is really about partnerships, about collaboration, always holding and centering community voice in this work, recognizing that those individuals who are closest to the problem are closest to the solution. So creating a table where we invite those who are living this work, living this life, in to identify strategies and solutions to improve health outcomes for all community members in King County. So if you've heard language around the ACH again stands for Accountable Communities of Health. Now I reference this for you and I give you this slide because you'll see that in the state of Washington there are 9 accountable communities of health. Interestingly, King County is its own accountable communities of health, Pierce County is its own accountable communities of health, and then the other 7 accountable communities of health across the state are a combination of counties. Why I mention that to you, and I think Meg also referenced it, the fact that gentrification is real and gentrification is happening. So folks who at one point in time lived in Seattle and close to the Seattle area are now being forced out and have to move down south. Now, I live down south, so welcome down south. I'll take you. Come on down south. I'll take you. But also recognize that many of the supports, many of the providers are not necessarily down south. So that recognizes that as people shift and as people move, they may be living in one area and accessing services in another area. So what I'm going to share with you tonight is only about King County's Accountable Communities of Health, because the uniqueness of this Accountable Communities of Health work is that it's community-based, right? So what works in King County may not work in Skagit County, may not work in Pierce County, may not work in Whatcom County, but it's really, again, centering the voices of the people who are most affected and most impacted by health disparities. So I reference that because many of you serve people who will be in multiple counties. So what I share with you tonight is not necessarily going to be true for folks who live in Pierce County. There are some general principles that will align. The most important thing to know is that the purpose of each of the accountable communities of health is really threefold. It's to improve quality of care. It's to ensure that we have better patient experience. And then it also impacts the bottom line, reducing the cost of healthcare. As it relates to King County, we have actually this slide's a little out of date because we have a 26-member board that is comprised of individuals who are cross-sector to, again, begin to address a way of, first and foremost, bringing people together to stop working in silos to identify what they think is right, but instead bring all folks together and then center community voice around how we can actually begin to address health disparities in King County. You'll see from the next slide, you'll see the representation across our King County Accountable Communities of Health Board. What's exciting about this work is that you'll see that we have our voting seats, and these seats actually represent different sectors. As I indicated, it's a multi-sector approach. So you have hospital and health systems on the board, community health centers, behavioral health, community-based organizations, government, public health, managed care, foundations, housing, tribes, long-term services and supports, primary care physicians, consumer and community members, and then at-large members, right? So any of you ever work with a board of 26 people? Right? You're bringing together folks around, again, multiple issues, and they're bringing in multiple things to the table, and it's important for us to do that. Why? Because we're creating a table where all these sectors are coming together to address health disparities in King County. Also, what's important about that is you'll see that when we look at our community-based organizations, we have 3 voting seats on that 26-member board. When you look at consumer and community members, we have 3 more voting seats on that board. That's 6 seats. And then when you look at our tribal representation, we have 4 seats. So that is 10 seats out of 26 controlling the decision-making around this work related to the accountable communities of health in King County. And I want to thank the Somali Health Board because you all hold one of those seats. And not only do you sit in that seat, you are representing not only the voice of this community, but the voices of other communities who are not necessarily at that table. And Somali Health Board, you have shown up in fine fashion and made the voices heard and had your voices centered as part of the planning and decision making. So I want to thank you, Somali Health Board, for making this time. Next slide, please. So why is this important to bring all these sectors together? And again, we go back to reducing costs. Well, we know that, again, holding that this is about ensuring, this work is about ensuring that people have an opportunity to live their best lives. We know that clinical care, research shows us, clinical care only represents 1/5 of the factors that impact health outcomes. 40% of those factors are the socioeconomic factors, your race, your income level, your education level, housing stability, access to food, transportation, open green spaces, right? What we often refer to as the social determinants of health. 20% of those outcomes are determined by health behaviors, right? So that health literacy, knowing what we can do, right, in terms of the screening, in terms of accessing healthy foods, living our best lives. 10% is related to our physical environment. I don't know anybody in the room like me has asthma, has been affected by all this smoke, right? So if we ever wondered about where we live and what our environmental conditions are that impact our health, just live in the Seattle-King County area over the past couple of days. And then only 20% is actually clinical care. I love this because it has research that shows us what we already know to be true. That a person's health outcomes are determined by much more than how often you go to a clinician. It's determined by, I loved what the sister said over here about those 8 women represent 80 women, right? Because I know that if somebody tells me that I need to go do something, I'm going to listen to it much differently if it's a person who I trust, who's from my community, than if it's just somebody that I'm seeing for 15 minutes, maybe twice a year, if not once a year. Next slide, please. So the goal in bringing together this multi-sector coalition is to recognize, again, that you have clinical care is only 1/5, determines 1/5 of your health outcomes. But then you look at all these other systems that contribute to your health outcomes. Housing, transportation, health care, specialty care, primary care, crisis response, jail, legal aid, all these sorts of things, right, can influence your health care. And it gets confusing if you're trying to navigate that. So if I'm a person who has a behavioral health condition and I'm also experiencing homelessness, how am I going to know I need to go to this office to access this service and talk to this person, but only show up between these hours because these are the only hours it's open? Oh, that's right. And I rely on transit to get there, so I have to make sure that I can only get there according to this time. And oh no, what if it doesn't align, right? So the purpose of this work is to ensure that we begin to connect those systems so that we can address whole person care. Because a person who is in crisis should not have to try to figure out which door to go to. They should be able to go to one door and have that one door help them to get what they need to succeed. So long term, what our overall goal is of this work is, right, this first system, this first one, I love it, right? Interconnected, HIE system. I'm giving bonus points to people who know what that means, okay? What it means is that we have systems, computer systems, that are talking to one another. So, if I go to the emergency department because of my asthma, and I'm treated, and then a referral is made amongst the clinician there that says, I need Marya to go talk to the Somali Health Board because, Marya's housing insecure, and so perhaps the Somali Health Board may be able to point her in the right direction. And then I'm the clinician, and then I say, bye, Marya, good luck. Okay? So I'm hoping that Marya goes to the Somali Health Board or that other referral, but I right now have no way of knowing if she goes or if she doesn't go. So the goal is to improve our clinical community connections so that when that provider refers me out for this service, that provider can look and see that I went and can also see what the outcome was so that we can begin to work in lockstep to provide both the community and the clinical supports that help determine health outcomes. Payment models. Success looks like ensuring that community-based organizations and those who are closest to the people that we are serving are actually compensated and resourced for the work that they're doing. Love the conversation about interpreter services. Ooh, that was hot. I was like, ooh, I could come back and talk about that, right? So it's how do we know, because that language line is not necessarily going to make it happen. Okay, I don't want to talk to a phone to tell me. I want to talk to a person who's sitting next to me. Okay, so how do we make sure that we get rid of the phone and we can get a person who can help us to navigate? Multidisciplinary cultural competent care teams. Love the conversation around cultural humility. This is a process. This is a journey. I have been working in the area of social justice, civil rights, human rights for the past almost 30 years. I started in the womb. I acknowledge that. I'll answer that question for those of you in the room. But, it's a journey. Okay, I've been doing this work for almost 30 years. I'm still learning. But having that willingness to learn, that openness to recognize that people move in different ways in this world, and it is okay for them to move in that way. So then how can we meet people where they are to help them achieve the outcomes that they would like to for themselves? And then finally, at the end of this work, we want to ensure that we have meaningful mechanisms for community and consumer voice involved in planning and decision-making processes around healthcare. So what does that mean? That means no more check the box community engagement that says, hey, we made this decision. Community, do you like it? Oh, you don't? Okay, next. Right? It's, hey, we're thinking about doing this. So how can we engage with you early and often to help inform the planning and decision-making processes? Again, our goal is that people in King County receive better, more equitable care. That community organizations get the resources and the supports that they need to help address the social determinants of health. And then providers get the support to improve their outcomes, right? People go into healthcare, this is an assumption on my part, I'm a lawyer, not a doctor. But when you go into this work, you do it because you want to make people better. You want to help people get better, right? And then a bunch of upstream system stuff gets in the way of making that happen. So the goal of this work is to help address both the upstream and the on-the-ground patient experience. So we're looking at policies, practices, procedures, but also looking at what happens in that patient-clinician interaction. Because if those two things don't happen in tandem, it won't make a difference. So our work is primarily focused initially around Medicaid population. Right? The reason I say initially is because if you've heard the word accountable communities of health, you've also probably heard Medicaid Transformation, MTP. Project, that's it, project. I do not like to speak in acronyms for that reason, okay? So the Medicaid Transformation Project says that we're going to only look at the Medicaid population, and we're going to begin to address and make some system investments to improve outcomes for that particular population. And in doing so, the goal is that it will increase and improve outcomes and health and well-being outcomes for all members of King County. So King County's work is focused around 4 particular projects. One is around transitions, to increase safe and successful transitions for folks who are leaving the jail and hospitals. The other project is around integrated care. So how do we integrate physical and behavioral health? The third is around opioid use disorder, looking at expanded access and improving prescribed practices for treating opioid use disorder. And then the fourth is around expanding supports for folks living with chronic conditions. Why it's important to point out that there are 4 particular project areas that King County's Accountable Communities of Health, HealthierHere, is working on. You'll hear us refer to it as a project portfolio, is because we also recognize there are a lot of issues and a lot of things that need to be addressed to improve health outcomes for folks living in King County. HealthierHere cannot and is not the be-all, end-all for all of those things. What it is going to do is focus on improving outcomes in these 4 areas, because as we improve outcomes in these 4 areas, we as a county will earn money to make system-wide investments that can touch a whole host of other areas. Central to this work is recognizing again that this transformation has to occur outside of clinic walls. It involves community-based coordinated care, improving equity and reducing disparities, and addressing the social determinants of health. Why we mention that is because this King County Accountable Communities of Health has been built on the values of equity and authentic community engagement. We have 5 values our governing board has established. You'll see them at the bottom of that slide. Equity, community, partnership, innovation, and results. Because at the end of the day, if people aren't having better experiences, then all of this work is for nothing. We're doing this work by bringing, again, clinical partners together with community partners so that we can provide the innovation, right, to try different things. We know that folks have been doing this before. HealthierHere is like not the first to try this, and we honor and respect the work that has gone before us. And now we're saying we have some additional investments that we can make, so let's see if we can't try a couple of new things. Let's see if we can't partner with existing partners who are respected in community, who are able to reach the populations that we're attempting to serve, where they are, in a culturally respectful way, right? So it's about that partnership. And we believe it's that formula of clinic and community that provides the innovation. The other thing that you'll see is that we have the 4 project areas that I mentioned, but there are also some system-wide investments that we'll be making. One is around training, practice, and coaching. One is around information technology, again, ensuring that our systems talk to one another in our clinics and in our community-based organizations. And then the third is around workforce development, which is, again, why I was doing my little happy dance in the back when we were talking about interpreters, right? So talking about our community health workers, our peer supports, our other community care folks who we know help to provide those supports around our community to access the clinical care. Those are the investments that we'll be making system-wide. So the next couple of slides that you'll see, I just wanted to highlight for you in the interest of time. I just wanted to show you this because you'll see each of the 4 direct project areas. And you'll see on the right-hand side of the slide, it has outcome metrics. The metrics are there because the Healthcare Authority for Washington State is requiring King County, so all of the ACHs, to meet certain outcome metrics, right? When you meet those outcome metrics, you then receive the investment dollars. So this Medicaid Transformation project is not a grant. It is about earning money to make investments. So you'll see these outcome metrics and you say, well, who created that? Why did y'all say that we're looking at overuse and behavioral health and fit. Why did you say that? Healthier Here didn't say that. These metrics are from the Healthcare Authority for Washington State. Then below that, you'll see the word levers. And what levers references is that's one of the things that we can do and invest in to help achieve the outcomes that we're hoping to achieve. You'll see the same thing for transitions, safe and successful transitions. You'll see the same for managing chronic conditions. And then you'll see the same for reducing opioid use. So what does all that mean for you? What it all means for you is that, remember, I go back to where I started and I said this is all about improving experience. So our goal is to ensure that we are engaging with community to identify what the experience is and to maintain accountability for improving that experience over the life of this work. One of the ways that we're doing it is we have a community and consumer voice committee that is a standing committee of the governing board. We have some members of that committee here tonight. Also, again, thanking you for that engagement and that involvement in that community and in that committee. That committee meets the fourth Monday of every month, and you can get information about how you can come to that committee by visiting our website at www.healthierhere.org. That is an open invitation. Anybody is welcome to come. Likewise, our governing board meetings are open invitation. Everyone is welcome and encouraged to come and be a part of those governing board meetings. Finally, one of the things that our community and consumer voice work group has done, committee has done, is they have created a community engagement plan. And as a part of that community engagement plan, our governing board has resourced a small grants program. Oh, thank you. Thank you so much. So we right now are recruiting applications for the small grants program. The purpose of the small grants program is to resource community groups and organizations to engage with their clients and their consumers around Healthier Here, because we want to ensure that people know about what's going on and know what to expect and know what changes to make. So I encourage you, if you are interested in the small grants program, applications are being received through September 15th. Our governing board has allocated a total of $160,000 to that program. So again, uplifting and ensuring that community is resourced for doing the work that you do. The final thing that I wanted to share with you is there's going to be more information. There's some flyers in the back. Healthier Washington is actually conducting a public forum next Tuesday in Tukwila from 5:30 to 7:30. And we encourage you to come out, bring folks, ask questions. The director of the Healthcare Authority will be there. Our executive director of Healthier Here, Susan McLaughlin, will be there. And this will be an opportunity, again, to ask questions, to learn more, and also to know how you can stay and continue to be a part of this work. So with that, I will stop and open and entertain any questions that you may have in the time that remains.
Thanks, Marya. Wonderful presentation. Any questions? Go ahead.
So you talked about Healthier Washington, just providing the initial funding. And is that an agency of the state of Washington, Healthcare Authority?
Yes, it is.
And is it part of this Medicaid Transformation project?
Yes, it is.
Okay, so and it's really for Medicaid dollars, I assume? Okay.
That is correct. Now, for Healthier Washington, I can't necessarily answer. So, yes, it's around Medicaid dollars. I'll also add, though, that for Healthier Here, again, King County's accountable communities of health, our governing board is making an investment, so investing some of those dollars in what is being called a social equity and wellness fund. So that will go, again, to address health inequities and health disparities across King County, above and beyond our Medicaid population.
And then the question, the other eight ACHs that have been are established, are Are they at the same level of establishment, do you know?
Yes, everybody's working on the same timeline, but they look different.
Sure.
They look different, so that's the important thing to hold.
So is the CDC for King County, are they going around the community and asking questions too? Because I know like Pierce County ACH is doing that, where the Voice Council goes out and, does the survey and asks community members what they feel that they need improvements in their health list. And so I'm wondering if King County CDC is doing the same thing.
That's exactly the purpose of the small grants program, is that the Community Consumer Voice Committee is wanting to, again, get those resources out to others who are above and beyond on the committee itself. There may be some committee members who apply for a small grant to be able to engage community members and populations as well. Yes. One of the things that's also really important as a former member of the Community Consumer Voice Committee is that we move humbly, right? And knowing that we cannot speak for everyone in community at that table. So we don't presume to speak for everyone in community at that table. And that's the exact reason, right? We're always holding who's not here, who's missing, and then how can we get the resources into the hands of folks who can reach those who are not at the table so that they can engage.
I think also we try to focus on making sure that we're reimbursing the community for this matter, and collecting information, so we make sure that we're authentically engaging us as providing care, providing us education, providing the support that we need in our act to, I don't know, like help with our decision making. So that's kind of what we're working on right now, is that small grants applications. If you know anybody or organization that can share that, please let them know about those fundings that's specifically for the community to make sure that we that voice. I do have a question. Marya, I don't know if that's something that we can discuss as CCB, but in terms of if this is a recommendation that maybe we can move forward with the board, but in terms of the community health center seat,
Yep.
have we talked about like that being something that's like rotated? Because I know that with the CHCs, they serve different communities that have different needs, and are dealing with different systems. So have we talked about, has that been a discussion around like making sure that that seat is rotated amongst the different CHCs?
I'll have to look into that. Yeah, I'll look into that and I can bring that back to the CCB.
Marty, I have a question, and this is where I get to put my pharmacist hat. With managed care systems having that many seats, and we're talking about population, Medicaid population here, there is that, and it's been going on for quite a while, and this is, I don't know if the ACH will have that leverage to actually figure out what is the reimbursement process within the PBMs, pharmacy benefit managers, because out of the 5 managed care plans, 3 of them, 4 of them, for folks with low income, they have to go through multiple pharmacies before they actually get their medications filled. So you have, let's say, if they go to Rite Aid and Rite Aid says, I don't take this insurance, Molina, they have to go on Walmart and go to Safeway, or they go to Walgreens and out of the suit. We're talking about a socioeconomic determinants of health. I mean, that in itself is a huge burden. So what leverage does ACH have to make sure that while they have that many seats there, what's the role? Because these conversations happen throughout the country, and there are a lot of states that are actually looking back and determining, okay, how do we go about the reimbursement process for that to make sure the Medicaid population is served from the health perspective?
Yeah. Great question. Great question. I don't have the answer, but I do know this absolutely ties into something I was just talking about, I think, yesterday. Because we need, I believe, and this is part of why we need to engage directly with community members, is identify what kind of barriers people are experiencing to having the health outcomes they desire. So I was using an example, in fact, again, I shared with you I have asthma. So I went and had a prescription filled, the other day, and I'm fortunate in that I have healthcare coverage. And then, like, when you get that sheet that shows you what your copay is versus what the actual cost was, And this one medication was $456. I did not pay $456, but it was $456. And so I was using this as an example because I said, you know what? If I didn't have the healthcare insurance that I have, I wouldn't have $456 to pay for this medication. And if I didn't take this medication, then obviously it would impact my asthma, which would then have me in the emergency room, right? So it triggers all these things. So I was using that very thing as an example because I'm walking in privilege of having the healthcare insurance that I do. But what if I had to go 5 different places to try to find who's going to cover this prescription? And what if English is not my home language? And what if I don't have access to transportation to get to these places? I mean, that's how this all compounds. So I say it's a great question because those are the kinds of upstream questions that I believe, and upstream issues that I believe directly influence and impact a person's health outcome that we need to begin to address, and we need to ensure that that's at the table. Because we do have those managed care organizations at the table. Now, we don't see insurance providers there, but that's a different conversation.
So speaking of going to all of those obstacles, always in the healthcare they talk about make sure that we prevent people from going to the emergencies because it costs so much. But then when you have to go through all of those hoops and you can't afford the medication, then you end up in the hospital. So they need to think about how can we prevent that from all of those, looking into all those angles so that we can stop from people just, ending up in the emergency room. It's going to cost more than $400 when they go to the hospital. So.
Absolutely. And if it's easier for me because I know I can go to the emergency department and they have to see me, they have to treat me, then guess what? That's exactly where I'm going. That's real. That's the reality of this. And that's what we want to keep front and center in this work, is there's a reason that folks are going to the emergency department, right? Something is failing somewhere. Let's identify what those system failures are. Let's identify what those people failures are. If I could tell one quick little story, is that okay? It's super quick. It's super quick. I was in a meeting earlier today, and it wasn't about this, but the person utilized an example of the integration of physical and behavioral health, and they were talking about a client who, this was a behavioral health care organization, a client who was in the emergency department, and at discharge, but before the decision was made to discharge the person was saying they wanted to go home to be with the Creator, right? Okay. So the person who's listening to that says, oh, you want to go home? Okay, we'll send you home. There's a difference between going home and going home to the Creator, okay? But if you're not listening for that, if you're not aware of that, then that could have resulted in a horrible outcome for that person who was asking for help. Now, the practitioner who was in the room, who knows what was going on with them? Who knows if they were just trying to see people quickly, if they just weren't attuned, they just heard, oh, home, okay, good, home, here you go, you're going home. But those are the kinds of things that, while we talk about the upstream, and in terms of how many different pharmacies you have to go to get your medication, that also has to be coupled with what's happening in that room, right, with our patients and our clinicians. So I again thank you so much for your time. I thank you for the invitation to be here. I thank you for your commitment to being a part of Healthier Here and a part of the governing board and a part of the Community and Consumer Voice Committee, and most importantly, a part of this community and lifting up and elevating community voice to ensure that community voice is centered as a part not only of this work, but all the other systems that are influencing health outcomes for our community members. I left my card in the back. If you have additional questions for me, you are always welcome to reach out to me. And I'm also happy to be here to attend future meetings, so you can always catch me here too, but you don't have to wait to do it quarterly. You're welcome to reach out to me. Thank you so much.
Thank you, Marya.